Hey, what's up, all my frequent flyers? And all those passerbyers and anybody in between. However you got to this video, welcome. My name is Dr. Darin, and I'm an emergency room physician in rural America. Now today, we're going to be talking about something that is more addicting than many narcotics. It has been scientifically proven
I only believe in science
to elicit the same reaction within our brain as that of a drug response. It is something that I would be proud that my children participate on a regular basis with.
What?
That is serving others. This is going to be a new series, which I'm going to call Carin Darin. Growing up, when I was a kid, one of my nicknames was Dare Bear. And that's what a lot of people called me in my family, especially my sisters and my brother. Now, my brother, he had this one specific name that I hated. And he would call me it when anytime I got a little too emotional, when I was whining or crying or just being a baby. He would call me Care Bear.
Just do that, Care Bear.
And I hated it because it was just such a soft term that my older brother called me. But I'm going to take that and I'm going to embrace it because I am a Care Bear. And this is Carin Darin, episode 1. 2018, I graduated residency and I started practicing emergency medicine. And I noticed a trend. And so I started paying attention to patients that were in pain and asking for pain relief, and patients that were in pain and were not asking for pain relief. And I started to see a correlation, started to ask questions. If a patient was in pain, I would ask them a couple questions. I would ask them, outside of the hospital, during the course of a month, do you ever participate in a planned activity of community service? That's it. Yes or no? And I saw this pattern that people that seem to be managing their chronic and acute pains better were ones that were in scheduled and regular activities of serving others on a regular basis. Pain is part of life. What I have been fascinated, though, of being an emergency room physician is witnessing how different people manage all that pain. So in my personal research, and through the research of people way smarter than me, supported that you can get high off of helping other people. When we find ourselves serving other people, they have shown that it fires in the same area of the mind, releasing that same reward mechanism, telling our brain we want more. It is the same release as medications treating pain. Amazing! And that high can help you get through those dark times, those painful times, those chronically never-ending, never-yielding, grinding times. And that's awesome. That's empowering. In my profession, I read a lot of EKGs, okay? Or ECGs. It's that pink squiggly paper that we print off and we put all those stickers all over your chest, and it allows us to measure the electrical impulse going from one side of the heart to the other. When there is dead heart tissue in there, it deflects that electricity in specific patterns and waves that we can see. And we can see if the tissue is dying, or if it's straining, or if it's having a hard time, or if it's too thick, okay? We can see certain patterns. When I'm reading these EKGs, the big banger that I'm looking for is a myocardial infarction, okay? It is a heart attack. That is when oxygen-rich blood is being deprived from getting to its destination. It can't get there, and so that tissue dies. So in our life, I submit that our EKGs are our calendars. I call my calendar my MeKG. It is my personal assessment on how I'm spending my time. If I look at my calendar and I do not see a scheduled opportunity to help another person, by examining my MeKG, I can help prevent me from suffering a myocardial infarction. And that is when I allow too much time to pass by without thinking of somebody else. I'm not participating in that by design reward system of thinking about somebody else and serving them. So I challenge you to take the opportunity to study your MeKG and look for evidence of myocardial infarction. Be a force for good. Help those in your community. If it's worth your time, subscribe. Please enjoy this quick video of one of those planned activities, a treatment to prevent myocardial infarctions.
Let us soft speak kind words to each other, at home or where'er we may be, like the warblings of birds on the heather. The tones will be welcome and free. They'll gladden the heart that's repining, give courage and hope from above, and where the dark clouds hide the shining, let in the bright sunlight of love. Oh, the kind words we give shall in memory live, and sunshine forever impart. Let us soft speak kind words to each other. Kind words are sweet tones of the heart. Like the sunbeams of morn on the mountains, the soul they awake to good cheer. Like the murmur of cool pleasant fountains, they fall in sweet cadences near. Let's soften in kindly toned voices our mutual friendship renew, till heart meets with heart and rejoices in friendship that ever is true. Oh, the kind words we give shall in memory live, and sunshine forever impart. Let us soft speak kind words to each other. Kind words are sweet tones of the heart.
That's awesome.
I'm putting this in my coffee. I love it.
I hope you enjoyed that, because I can watch those cuties all day long. I challenge you. Study your EKG. Look for evidence of your myocardial infarction. Go say kind words to others. It'll do you good. I promise it. You'll get a high off of it. And that is a doctor-approved high. Noggin, motherfucker gets this squibbing.